Well, good morning. I'm Steve McCabe, the MP for Selly Oak and Birmingham and the chair of the all-party group for heart valve conditions. And I'm delighted that I'm joined today by Alex Norris, the MP for Nottingham North and the Shadow Minister. Now, tell me if I've got this right, Alex. You're the Shadow Minister for Prevention, Public Health and Primary Care.
That's right, yes, yeah, the full gamut.
The full gamut, exactly. Now, Alex, as I say, this is part of our 100,000 conversations. We're trying to encourage people to speak about heart valve conditions and heart valve disease, not to hide it or not to be frightened, but to go out there, ask questions, see their GP, talk to friends and relatives, and it's in that context we're asking you to join us. Can I just ask, have you got any members of your own family or any friends who've had heart valve conditions in the past?
Yeah, actually, yes, within my own family, I've had a couple of incidences of it. I think it's one of those things that actually probably affects most families and touches most families in some way. So that's part of the reason. The thing that I think I've learned from that is that's why it's important that we talk to each other about it. This is happily not one of those issues that comes with stigma with it, but it is one of those issues that perhaps doesn't get to the top of the awareness piles. So, part of this is talking to each other to try and make sure that we look after each other, really.
No, I think that's a very important point. As you say, it doesn't carry a stigma that maybe sometimes other conditions have for people. But I think one of the problems is people are too quick to dismiss breathlessness as being something else. Maybe they're just too tired or they're getting old or whatever. But of course, what we know is breathlessness is a classic condition. And I guess, well, with your primary care hat on, I guess your advice would be go to your GP and get that stethoscope test. Is that right?
Well, this is right. See your GP. It's challenging because we've been through this awful last nearly 18 months. And one of those things that we know that's been a feature of that is people not perhaps wanting to go into primary care or certainly to general practice, but those behaviours that we'd kind of been trying to get people into, whether that's around, your hacking cough and that and the cancer dimensions to that, or as you say, Steve, there, around breathlessness, we've kind of put a reason in front of people to say, well, maybe tomorrow, think about it tomorrow, or the day after that, and kind of never get to doing it. So we've got to really get back into the place of saying to people, no, this is what the service is for. You need to be sure, you want to be careful, so do it.
Yeah, I was going to pick up on that point there, Alex. Your early detection is so important with heart valve disease. We know evidence suggests that 50% of people with severe aortic stenosis, the most common form of the disease, will die within probably 1.5 years if not treated. And that clock starts ticking way back in primary care. And you're absolutely right that when we have those telltale red flag symptoms of breathlessness, tiredness, dizziness, bit of chest pain, perhaps even just feeling a bit older than you think, getting into the NHS and getting into to see your GP and saying, can you have a listen? Because the heart murmur is the earliest point which we can detect the disease, and then you're on that pathway. And we're blessed within the NHS of having fantastic therapies and treatments accessible to people, as long as we get them in the right place at the right time.
In terms of access, I mean, you represent Nottingham North, quite a diverse constituency and quite a range, income range amongst your constituents. How much of an issue is access for you, and what do you think we could do to improve things?
So access is an issue. I mean, we would have that. It's the inverse care law, I think they call it. So we would have more, say, pharmacies per head, because that's, we would have more healthcare needs per head. So that sort of thing is a good thing. We have a challenge. We're lucky, I guess, because I'm the outer estates of a big city, so we have all the benefits of a big city in the sense that we can get GPs to come. We're not. Some of the challenges they have in say coastal communities or towns that don't have the infrastructure that we have in Nottingham, that is a real challenge, which creates those sort of access issues. So again, we've got one of the best hospitals in the country, one of the best hospitals, frankly, in the world. So again, we're well served in that sense. For me, the access issue actually probably starts to step forward, and I think this is common to communities like mine, of getting people to actually to access the services that are there for them, and not explain away the symptoms in much in the way that we've talked about. And that, before the pandemic, that's but frankly, before my time in Parliament, when I was a local councillor, that's been one of the things that I've spent the most time on, particularly with regard to lung cancer. Has always been a real passion of mine, because it's a killer in a community like mine. There's a really there's quite a nihilistic view of it, in the sense that lung cancer is the one that my nana got, and then she was gone in a few months' time. And it doesn't have to be that way, but we present really, really late, and then obviously, as we know, your outcomes are much worse. And I think the commonality to what we're talking about today, that reads across very well. Earlier is better. Earlier your outcomes are gonna, and some of the treatments we hear about, wonderful things. So for me, it's awareness, it's conversations, it's if you have to drag granddad in, drag him in, whatever it takes to say it's not just tiredness. And all that you said, Steve, I could recognise. All of us will feel like that at some point, and you can explain that away as much as you want. So I think that's why we need to kind of talk to each other and be with each other. And as I say, whether it's a carrot or a stick to go and get checked out. But from our point of view, as legislators, as decision makers in this country, our end of that bargain is to make that as easy as possible. So whether that's having GP services that you can get in to see, whether it's perhaps having it in other community settings, we've got a responsibility to make sure that happens.
Excellent. So I think the message there, you summed it up. It's awareness, it's conversations. Talk to your family, talk to your friends, get it checked, and we'll be looking to people like you, Alex, to help us bring in the innovations and the technology. But as Will says, this is something that's eminently treatable, and if it's picked up early enough, as you said, Alex, there's no reason why people can't go into and lead a full and active life. Look, Alex, I know how busy things are for you at the moment, so I just want to say thank you very much for finding the time to do this with us. The people hearing about heart disease is the thing that's going to make a difference, because just somebody listening to you and they're thinking, I've been feeling a wee bit breathless.
But also, Stephen, and you're a really good model for this. We have to do these things themselves. I'm bad for trying to look past things, because I know, as you do, when I open my diary up on a Monday morning, if you said to me, right, when's your hour or an hour and a half out of this that you could go and, if you needed to get something looked at, you could. And the answer is it doesn't exist. So you think, well, we'll put it off to the weekend. Well, actually, then you get to the weekend and it's not much better. You've got family time on. And similarly, I was having a little smile when you talked about your symptoms, because, and this is not to make a kind of a radical defence of politicians and our workloads or whatever, because I don't think there's much of a market for that. But we're always tired. You're always tired in some way. So we have to make sure that we ourselves do get these things checked out. And I'm a little bit younger than you, Steve, but I'm entering into that age range where that's going to be more of a feature of my life. And you have this tendency, and this is true for this isn't just for for politicians or parliamentarians, for anybody living kind of busy lives, and younger people as you start to get older. You get yourself thinking that you're Superman. I can't tell you when I last needed to go to GP. I've never needed hospital services. I've never had a serious illness of any type, but I will. All of us will at some point. And for people like me, for perhaps as I say, that are going into that age range, to not try and think that you're some sort of robot. So I have to model that myself, and you can tell me that if you think that I'm not, and that can be one of the thousands and thousands of conversations we're having as a nation.
Well, I think that's probably a great point to end on, because that's exactly what we've got to do. We've got to talk to each other, family, friends, and then you've got to find the time. You've got to find the time, and you've got to get it checked. Alex, thanks a million.
Brilliant.
Good luck for the future, and thanks very much for helping.
Thanks, guys.